Every year, thousands of trans people across the United States face an invisible crisis, one that is not rooted in identity, but in injustice. According to the Trevor Project, over half of transgender and non-binary youth have seriously considered suicide. And yet those seeking gender-affirming care are met with wait lists, legislation, and stigma that too often stand between them and survival. This film explores how systemic barriers rooted in the medicalization of identity, stigma, and the weight of minority stress shape the lives and mental health of trans individuals. But behind the data are real people, real stories, and real fights for dignity.
My name is Michelle Lee Garrett. My pronouns are she, her, and I am a proud queer transgender woman.
My name's Jocelyn. I am 42. I'm a mom of 3, and my youngest child is trans.
I'm Susan Trainer, and I am a nurse practitioner working in a local health system in central Pennsylvania.
So, what does gender-affirming care mean to you personally?
So I've been transitioning for 5 years, and it is not an exaggeration to say that gender-affirming care has saved my life.
For me, gender-affirming care means that I got my kid back. He was so sad. And finding out that he had gender dysmorphia and finding out that there was care available for him. He started on blockers when he was 11 and was on them for 5 years. It really gave us time. It gave us time for him to understand what he wanted to do and how to move forward with his life. And it gave me my kid back.
My specialty expertise is taking care of people with diabetes. However, I do take care of trans people who live with diabetes. What I've been able to see is the degree of emotional distress that they experience navigating the health system, whether they're dealing with some mental health issues or whether they're dealing with other clinical health problems. Often the experience interacting in the health system is negative. It's there's a sort of an underlying unspoken stigma.
So right now, he is stopping blockers just because he's been on them for 5 years. So we decided to stop the blockers, but then we also got a letter from our insurance company saying they would be no longer covering the blockers because they said that his diagnosis of gender dysphoria was no longer valid. If he did not have these blockers and if he was not able to stop his period, I don't know where he would be right now. These blockers are very expensive. They're almost $40,000 per shot, and those are every 6 months. And there's absolutely no way that we would have been able to afford to continue to do the blockers if our insurance was not covering them.
What are some of the biggest misconceptions that you can tell me about gender-affirming care?
So there's a lot of misconceptions. I guess the most important place to start is that gender-affirming care is life-saving medical treatment. Gender-affirming care is validated and endorsed and recommended by every major medical association as the appropriate way to care for and to treat transgender people.
I think people think that we're getting our kids surgery right away, which is ridiculous. My kid has not had surgery and will not have surgery until they are done growing, which is going to be in their 20s. My kid is a normal teenager. They like to play Minecraft. They're on their phone all the time. Like, they don't want to clean their room. You know, they don't want to do their laundry, like normal kid stuff. My kid is just a kid, and he just, needs his medicine. We did everything by the book. As soon as we found out that my kid had gender dysphoria, we were on the National Association of Pediatrics website. Like, we were reading what the research was saying and how to move forward with gender-affirming care. The first thing we did was we got them a therapist. They have a trans male therapist. Like, that's amazing. So he can ask questions to him and they can have that connection. These answered questions that I can't answer. I'm not an expert in this. The first thing I think most parents do, is talk to their doctors. And that's what we did. And that's how we moved forward.
After Trump issued the executive order prescribing a ban on gender-affirming care for people younger than 19 years old, I became very concerned. I treat adults with diabetes, so I don't have patients that were affected directly by that ban. But what concerned me about that was that we, as a health system, my health system, other health systems, health system sort of in the broader picture, there was this idea that previously evidence-based care that was being provided to people, all of a sudden arbitrarily, because of an executive order, political executive order that was unconstitutional, was now being used to threaten the health system by actually threatening the payments to that health system for any care.
The thing that happened most recently, as soon as Trump was elected, we were really nervous, and we kind of withdrew from being more vocal about how we were getting care, and also that my kid was trans, because I feel like he could pass. So we kind of stopped talking about it. So we don't feel safe is, I think, the number one thing.
The erosion of rights never begins with a loud crash. It starts with silence, with one bill, one restriction, one refusal to see trans people as fully human. We are watching that silence grow louder, even in the places that once promised safety. But this is not the end of the story. It is the moment we must decide how it continues. Because trans people are not the threat. They are our family, our neighbors, our future, and their right to exist, to thrive, to access care is non-negotiable.